that her Majesty Mother Bank for Africa acted within the ambit of the law during withdrawals by one of the
What is this one? Some people don't know that.
She doesn't know she's videoing herself. Oh. Hey. Mommy said you're videoing yourself.
Emma does not know.
Who doesn't know?
Mm-hmm. Mm-hmm. Mm-hmm.
Okay. Oh, sorry. Please forgive. I did everything possible to join. My internet wouldn't work, so I'm working on a modem of another platform. So please, I'm so sorry for the delay in starting. Good evening. Please forgive me. Totally is it? I don't know whether it's network, but I struggled with it. And thank God I'm finally here. And I'm happy that I have a more secured network so that we will have no interruptions. So forgive me, and we will get started. Good evening, all, and welcome to the platform.
Good evening, Doctor.
Good evening. Good evening, sir. Forgive me today. You know, it's not been happening. So for it to happen, I'm sure you're like, something is wrong somewhere. Sorry, please. Thank you. Thank you. All right, thank you. So we're going to get started immediately. So as a way of introduction, so how did this hypertension topic come about? For those of you joining for the first time, today is Wednesday. We call it Wellness Wednesday. And on every Wednesday, we in this family, it's a community of, we call ourselves sickness-free body community. We don't want to be sick. But even if sickness will come, it will come and go because we live on earth. However, we are very conscious of doing our part to ensure we contribute our quota for whatever we get as health. So that is what this community is all about. The second thing about this community is that we share only science-backed, evidence-backed information. Not, anybody can go online and Google anything. No, this is not what we do here. So on this platform, we actually share things from our clinical experience, things we have seen, lifestyle medicine and doing wellness is becoming popular. So a lot of people lean on the internet to get whatever information they can manage and get. And most of the times they end up hurting themselves, even in trying to do the right thing. So this is why this platform exists, to give you not just what is out there, but what is practical at home. So you can go online and find out that if you eat artichokes and blueberries and raspberries, you will get rid of your hypertension and diabetes. But we don't do artichokes and blueberries and strawberries. So we probably do okra and I don't know, grapefruit is more closer for us over here to do. So the point is that this platform is based on clinical experience, one, and everything that we talk about here is clinically validated and science backed. So, and then evidence based things is what we discuss here on this platform. For those of you joining us for the first time, we just go as the spirit directs somehow. Today we might talk about sleep as medicine. Tomorrow we might talk about hypertension. Then we'll talk about water. We can talk about cancer prevention because as you learned last week, just about anybody can wake up and hear that there's a diagnosis for cancer. So the question is, if almost everybody is prone to having cancer, just like everybody's prone to having hypertension, then what can we be doing on our own to ensure we never get a cancer, hypertension, and the likes? So that is what this platform is all about. I know that most of you know my name. My name is on that advert. Every Wednesday, they send out this information for you, a reminder. My name is Dr. Susanna Adams, but they call me Dr. Susan, which is still okay. And my background is I have a master's in preventive and promotional medicine. So that's what I'm practicing on this platform, amongst other degrees that I hold within the health and medical space. So we are going to get right into it. So what is the background story to this, our presentation today? So we had a client come to our clinic, Dr. Physic Clinic. That was sometime late last year. And the person goes to the gym, the person exercises, the person lives in the gym actually. Every fitness club, the person is always from golfing to tennis to the person he's doing everything possible. And then all of a sudden he's like, they say I have high blood pressure, but I'm always exercising. Why am I healthy, but I have high blood pressure? Honestly, I was like, oh, sir, So I went to do a lot of homework. And what I actually, because when you're in school, even if you're an accountant or a lawyer or anything, whatever they teach you in school, the objective is to pass. Once you get to the real world, it's a real world experience that actually makes all those things come true. So, but if you don't run into some cases or situation, you don't remember that part of the notebook. Really, you don't remember. And all the professionals on this platform can attest to that. So when the person said, what could be wrong? I was like, wow. So I had to review my work and I realized that we have a lot of healthy people, in quote, coming to the clinic and complaining that they suddenly have high blood pressure and nothing is wrong with them. And then once they have this high blood pressure, I've had people that have high blood pressure age 17, age 23, 26, all the way till 80. There are some people, they started having high blood pressure when they're in their 60s and 70s. Some people started from 16, or even less. And then some people develop high blood pressure when they were pregnant, some people, but something always happens in general before the high blood pressure comes. But then there are just those few people that nothing, you just decided to check randomly, you still feel normal, and then the blood pressure is high. So today, what prompted this is that 2 weeks ago or so, in the Lagos facility, we had another client who also approached me. I said, I'm always in the fitness club. I do everything. I'm healthy. Where is this high blood pressure coming from? So I decided, okay, you know what? Maybe my family, which is you on this platform, we need to know, totally understand about high blood pressure the best possible way. I am not a cardiologist. I believe you people are not cardiologists either. But the part that the cardiologist will not have the time to explain to you, it's where I'm going to really lay a lot of emphasis, because this hypertension, I found out, can come out from anywhere. It can, okay, hear this, even before I get to the body of the presentation. You can't believe that just, oh my God, just your, oh God, in fact, let me just wait to get to that part of the presentation, because I was like, wow. So slowly and gradually, I think after they have exhausted the core heart and major organs that contribute to regulating the blood pressure, I think they've done many other research, because if they've exhausted and they didn't find, they keep researching and they have found many other places, many other reasons and where this hypertension can just come out and come and attack somebody. And thank God, you will also learn here that there are modifiable risk factors and non-modifiable risk factors. That means there are things we can do to change, and there are things that we don't have control over. So let's just try to get into the slide and kind of understand high blood pressure, because one thing I found out, especially from my pharma background, most of you know that I also have a doctor of pharmacy degree background, is that I realized that for every part of the body that contributes to high blood pressure, the pharmaceutical industry has developed a drug to, okay, let me explain. So for example, let's say the kidney, the vessel, they've developed drugs along all the paths that regulate blood pressure. So that is why sometimes when you, for those of you already have high blood pressure, you say you will be on this high blood pressure, it's not working. They'll change it to a different class, it's not working. They'll add another one because they're targeting 2 parts, 3 parts, 4 parts, like that. But you know what? 99% of the times, the hospital don't really have too much time to practice that part where it's called modifiable risk factors. So if you buy original drug, not all these drugs that they just bring the generic and put small packet insert. If you buy original drug, if it is diabetes drug or hypertension drug, you're going to see inside that packet insert, if you read it, nearly 100% of them, especially for hypertension, diabetes, it says along with lifestyle modification. It always says that. But the question is, where do you go to fulfill the prescription of lifestyle modification? Where do you go for that? Nowhere. So that is why we have decided to bring about this platform, so that we can do our own contribution to ensure that we live the healthiest possible life. Because if we have the healthiest life, we can actualize our fullest potential. We can be able to do what God put us on this earth. We can actually enjoy the fruit of our benefits. So that is what we are all here for. So let me get into the slide immediately. And then just a quick hint. This lecture is going to be part 1 and part 2. And the reason, oh my goodness, please, can you give me literally 1 second? Sorry. In switching around, you know, I told you I had technical difficulties. So in switching around, I did not upload the slide. Hang on. Please just give me less than 1 minute. Thank you. So sorry, please.
We lost you. Hello, man. We lost you.
Network is bad. We are not hearing anything.
That
Again.
network. You say you should give her time. Network
Okay,
will go.
thank you. Thank you.
Okay, I so much appreciate your patience. So I swapped so when I told you in the beginning that I had to move things around a bit. So I have done that. Hang on 1 second. Okay, so here we go. Let me just share the screen and we can just get going. Alrighty, so share the screen. First of all, screen share, start broadcasting. Start broadcast, okay. There you go. All right. Okay, so the topic today is conquer hypertension. Okay, it's a little bit ambitious to say conquer hypertension. I know that many people know me to not be the exaggerating type, but I do believe that we can conquer this hypertension. If you don't want hypertension in your body, you're going to invest small energy and just find a way to get rid of it. Because it's very tricky. It's as if hypertension is coming from almost every organ. Oh yeah, wait now. Maybe you did not know what I'm about to share, but today you will appreciate a little better. Alrighty, so the first thing to know is that the objective of this class is just to educate the audience on causes, effects, and natural management of hypertension through lifestyle and wellness practices. I want to use this opportunity to say that the drug industry, honestly, they have really tried. Because if we had to really depend 100% on natural medicine, this is the first time I would use my mouth to say this because I practice natural medicine. But for me to open my mouth and say this, then it means it's serious. I've so studied this hypertension thing to find out that if you just say, okay, if the scientific drug, the pharmaceutical drug, which they have studied every part of the body where this thing can come out and choke you, they have studied it A to Z, study, and they are still missing it. I think if we just went only through natural medicine alone, it's possible that we could have missed it. But the good news is that when we do it in combination, we can actually eventually conquer, like clean out the body, fix the root cause, and then the blood pressure medication can actually either stay a lower dose or even disappear. So that is what we observe in our clinic. So when somebody comes to Dr. Physique, for example, if you're already on high blood pressure medicine, we don't tell you to drop it. Patients will go and drop it on their own. We don't tell you to drop it. We say, wait, let us correct your body. So my advice to everybody is that whatever you're going to learn from this platform, please, the first thing to do, don't just drop your high blood pressure medication. No. Start the lifestyle modification and be monitoring. You notice that the blood pressure is coming down, then you first may have to half your dose. Coming down, and then you realize that some of these high blood pressure medication, they are two in one. So for example, if you're on X-Forge HCT, so you can just go from X-Forge HCT to X-Forge. So what am I sending? The message I'm sending is that when you are correcting your high blood pressure based on what I'm going to teach, you may need to work with a doctor or you have to taper it down. So high blood pressure medication is just one of those drugs that we in the pharmaceutical industry have actually made sure that you just don't drop it. If you drop it, it will bounce so high back and then you go back and take it, then you drop it, it will go back up like that. So it needs to be tapered off. So you correct your body and then push it out. If that is your objective for listening to this message, if you're ready on the high blood pressure medication. Now, if you're not on high blood pressure medication, then this lecture is the best for you, because it means that you have every reason never ever to get on the high blood pressure, except you have what they call non-modifiable risk factor. So let's look at all of that. So I will mute again so that we don't get that much interference. Alrighty. So that being said, so what? First of all, what high blood pressure, hypertension, all the same thing. So hypertension commonly. So when you say, "Oh, what is hypertension? What is high blood pressure?" Just for you, just take it that it's all the same. Okay, it's one of the most common yet silent health challenge affecting millions. I don't know of any household that can say, "Oh, nobody in my life has high blood pressure." It's rare to hear that. Okay, so it is often viewed as a lifestyle disease, okay, or caused by poor diet, inactivity. However, many apparently healthy and fit people, remember the reason why we did this lecture is because I have too many healthy people telling me, why do I have high blood pressure and I am fit, okay? And then not to talk of people that are not fit. Then what are we talking about? Develop high blood pressure, even with normal weight, regular exercise, and clean diet. So this raises an important question. If fitness and good diet it protects us from high blood pressure, why do some still experience high blood pressure? We will look at that today. The second thing is that the answer lies beneath the surface in hidden physiological imbalance and internal system dysfunction that disrupt normal blood pressure. So, you know me, I don't like reading slides and everything. The whole thing is that forgive yourself if you already have a high blood pressure. It is not your fault. It can hit you from, oh God, let's just get inside the presentation. So before we go there, what is high blood pressure? So when you put a cuff, there's something they wrap around your hand, they'll be pumping it like this. Some two numbers will come out. The one on top is called systolic. The one on the bottom is called diastolic. What should those numbers be? Okay, so this is just over exaggerated, over blood pressure. You see the blood flow is straightforward. Hypertension heart, your blood flow is in zigzags and stuff. This is an oversimplification, but just to let you know that something happens around the heart that makes the heart to develop more pressure, to pump more blood so that you can meet up your oxygen and blood volume regulation. So let me even say something there. So there's a certain blood volume that your own unique body must pump through the heart for the gauge. There's a gauge that regulates the pressure. So they say the normal pressure, normal in general, it's not for everybody, but in general, because there are some people that have a little bit of low BP naturally, and there are people that have a little bit on the higher, but averagely, they used to say there's a pressure gauge somewhere around the heart that anything around less than 120/80. This is controversial today because there's been so many studies. I just read a study in the New England Journal of Medicine, and they have actually changed this. So everybody is just coming up with their own. But you know what I say? Listen to your body. Your body will tell you if you're okay. And then stay as close as possible to these numbers that we are asking you to stay close to. And then for those of you that are micromanaging the high blood pressure I beg you in the name of God, you're going to scatter your kidneys. You're going to scatter many things. Because they're like, I don't really have BP. It's always around 130/90, and you ignore it. For how long? That is the question. So a healthy blood pressure, they say it should be less than 120/80. This has changed, but I want you to know it's around this number. So we believe that anything around 120 to 129 for the systolic, remember I said the upper, when you're reading, the upper part of the reading is the systolic, 120 to 190, or anything still less than 80, we say that you have elevated blood pressure. Elevated, it's elevated. So at that point, they don't say you have BP yet. Also, for those of you that when you finally have your BP, you run to a doctor, and the same day, or no, Nigerians, we don't even go to doctor all the time. Some of us even run straight to a pharmacist. When you run there, they start giving you blood pressure. It's not correct. If you're not symptomatic and it is bearable, and that's why it's best to work, you're supposed to check that blood pressure minimum 3 times. Then if there's consistency that is still up after 3 times within a week, then you can now say, so because when it's high like that, the doctor can actually prescribe you a blood pressure monitoring apparatus and say, take something to sleep, rest a bit, and monitor for the next 3 days to a week and send me your reading. So when you do that, then the doctor will see a consistency and then now determine that, okay, this, or if you're going to clinic month 1, month 2, every time you go, they notice that over the past 3 visits, this BP is staying elevated. Then we can now say, let us put blood pressure medicine. But people that are in a hurry to sell their jobs, sorry to put it that way, the minute they just see the BP is high, they don't know whether you were stressed, you just lost money, you just lost a job. They don't even know what took it there. They don't prescribe rest as medicine and jump into, I don't like that, and I want us to be cautious. So that is why it's best to work with a professional. So a doctor, a medical doctor, can actually know better how to manage you. And if they really must put you on the blood pressure medicine, then they will put you on blood pressure medicine. So since this is not a cardiology class or any of those serious classes, just quickly, I want you to know that there's hypertension stage 1, and there's hypertension stage 2, and there's hypertension crisis. We have hypertensive emergencies and hypertensive urgencies. All of them are treated differently in the hospital. But just in general, without boring you, I want you to go away with only one number in your head. Around 120/80 is okay. If it is consistently above 130/90 and is consistent, I may need to do something. Even if you're still on medication, except your doctor says it's okay. Okay, so hypertension is generally a chronic medical condition in which the force of blood against the artery wall remains consistently too high. Remember I said there's a pressure gauge, but the better way to put it is a force of blood, okay, leading to progressive damage to the blood vessels and organ. So what is that saying? That if you have persistently high blood pressure that is not treated, you're going to end up with what? A blood vessel damage. You can burst the artery. I mean, organs can go, like the kidney, etc. So let's go to the sweet part. So hypertension, they say there's primary, there's secondary. What is primary? This one, it develops gradually as we age. That is why after the age 30, between 35 and 45, most people that will have high blood pressure, they will get it. So it develops gradually, but is especially linked to lifestyle and genetics. So somehow, if your father or mother had some kind of a narrowed artery by nature, they might hand that, or a hardened artery by nature, they might hand that over to you, and you can't escape it. So, but there are ways that we can still push and ensure that, somebody said, why can't my father and my mother leave me inheritance and wealth? Why must it be their disease, or however the person put it? The point is that you must not, and to God be the glory, inherit the bad part of your parents' health. God will help us so that we only inherit the good part of our parents' health or grandparents' health, or genetics. We get the good genes. So there's something called secondary, which is caused by underlying disease. So if you have an existing kidney disease, high blood pressure can come. If you have existing so it can come from anywhere. Okay, let's get into it. Okay, we've talked about risk factors. So where can it come from? So high blood pressure can come from age, as I said, from 16 to 66. High blood pressure can come, and even beyond. So age is a big risk factor, especially when you're older, and it's non-modifiable. You can't modify your age. You can only change it for civil service job or whatever, but for blood pressure, you cannot mess around with it. Family history, non-race. So more Black people, well, at least when I studied in the US, more Black people have high blood pressure than the white people in the United States. So, but then there were more white people with cancer and less Black people with cancer. So, like, they do all these racial profiling and studies, but in general, this is how high blood pressure is a Black man problem. And we will find out today. Now, for the modifiable risk factor, so there are two things that can really take you there. One is not modifiable: age, family history, race, which is genetics and all of that. But the modifiable risk factor, high salt, alcohol, you can throw it away. One of our clients that came, this one is actually a woman. She had already stopped eating salt. She had already removed alcohol. She's a female. She actually smoked when she was 19 until when she was 21. She stopped smoking. Ah, wow. And then guess what? She still ended up with high blood pressure even after she had removed all of these things. So, what are we going to do? I will tell you. Obesity. So, if you have weight, especially around your stomach, 80% of those people will develop high blood pressure. But there's this 20% lucky ones that no matter how big your stomach is, you will not get the high blood pressure. But 80% of abdominal obese people will have high blood pressure, number one. Number two, it means that if you don't get rid of if the cause is the abdominal obesity, if the obesity, if the fat stomach does not go, then you have to be on medication for life. So what are we? So I'm sorry, the truth hurts, but this platform is for telling the truth. So for those of you, it's like, oh, I want to get rid of my blood pressure medication. Then look at all of these things that I am mentioning. Which one are you still holding on to? Because for as long as you hold on to any of these, then, it's going to be a tough one, but we will get there together by the grace of God. So inactivity, every 1 hour or so, stand up and walk. I know somebody who has a day can, if in fact, if he did not do his 10,000 steps, he didn't feel like he lived that day, and so on the activity part, he has covered it. But what about his stress level? So it's basically then this white coat syndrome. That means some people, when they get to the hospital, oh my God, who let the dogs out? That's when the blood pressure that was normal at home becomes high. So for those people, the doctor will say, send me your reading from home for the next 1 week to 3 months. And there are some things that we can give you to wrap around your body so you can be testing it, and then we will do the readings after. There are many ways. Another modifiable risk factor: poor sleep and unhealthy eating, etc. So the part that will really, really interest you. I know that so far everything has been interesting, but this one will be like, wow, I did not know. Okay. So most people, when you hear high blood pressure, the first thing you thought, like even patients, when they're talking to me and say high blood pressure, unknowingly, they usually carry their hand and touch their heart or their chest area because they believe that blood pressure is happening in the heart. Yes, okay. Yes, but maybe not 100% correct. Let me explain why. So these are the organs that we need to be concerned with that is messing up the blood pressure. Number one, the cardiovascular system. So the heart itself can cause blood pressure problem. So for those of you that say, oh, like I have a lady friend and she's the fitness freak and everything. She said, Dr. Susan, I keep doing ECG, echo, all the heart tests, and they say it is perfect. I have news for her today. I wish she's on the platform. It may not be in the heart. So that is why when you go to the cardiologist and the cardiologist says, hey, your heart looks okay, you go home and wonder, is it from my village or what is going on? Number two, it can come from your kidney. So look at it, your heart could be perfectly okay, but something is going on with your kidney, overproduction of hormones such as renin. So this kidney, this is not a technical class, so I will spare you. But for the technical and medical people that may be back here, the kidney produces renin. And if there's maybe hyperproduction of renin, you know what happens? There's displacement of sodium. So too much sodium will come in and water follows sodium. And there's too much of what they call blood volume. And when there's too much of blood volume, automatically the blood pressure will go up, etc. So what am I preaching is that these systems can work differently to increase blood pressure. So it can be from the cardiovascular system. If they didn't find it from the cardiovascular system, can be from the kidney system, okay? It can even be from the endocrine system. What is endocrine system? This endocrine system regulates your hormones. We've been talking about hormones such as your your cortisol levels, epinephrine or epinephrine. Epinephrine or epinephrine is because we've done a lecture on stress management and remember your fight, flight, and all of that. So endocrine system. So look at it. You go to the doctor and doctor says you have high blood pressure. In your mind, something is wrong with your heart. But for all you know, nothing may be wrong with your heart. Nothing may be wrong with your kidney. It might just be from your endocrine system. Okay, what about your nervous system? Your nervous system also actually contributes to high blood pressure. So you can imagine, what if nothing is wrong with your heart, your kidneys, your endocrines, and it's wrong with your nervous system? That is why, let me teach you people something. This is why sometimes when you have a high blood pressure, some doctors will start by saying, take this drug, go and just sleep. So the doctor is trying to calm your nerves. And that's why one part of our lecture, which we say every single Wednesday, is rest or you'll be rested. So they prescribe mandatory bed rest for you. And when you rest, you see that the BP will just disappear. So it could have been from the nervous system. Okay. Another one is that it could be from the vascular endothelium. well, another word for it, I put it in bracket, is your blood vessel lining. So your blood vessel lining, some people have, um, even your blood vessel lining makes production. It makes production of things like nitric, this production of this thing, nitric oxide. Like the same thing that they use in Viagra. So you can have more of vasoconstriction or vasodilation, etc. So the point I'm making is that any one of these systems can be responsible for your BP. And you're wondering, I am going to the gym, which the gym can take care of the cardiovascular health. So nothing may be wrong with your cardiovascular system. It could be your kidney, it could be your endocrine, it could be the nervous system, it could be your blood vessel. So you can imagine that blood pressure can come from, this is not all though, this one is introduction. Okay, people say Tere Cambia. It's coming. Let's just keep going. So why am I so excited about this topic is that I love to give you a peace of mind that you just forgive yourself because you've done your part and you're like, I don't understand. Just know that it is not your fault. The body is so complex. I mean, it is so complex. In fact, that is why they say that we are fearfully and wonderfully made. Very fearfully and wonderfully made. So please forgive yourself. We will see what we can do to our own contribution to see how this thing will go away. So apart from understanding the body systems that can contribute to this blood pressure, we've also understood modifiable risk factors and non-modifiable risk factors. So the modifiable risk factors, we can play around with them. Like I told you, I have somebody who started with removing salt, removing alcohol, removing this, removing that, and then by God's grace, she got it. So she's not on, right now as of today, she's no longer on any blood pressure medication, but she really had to take time to modify. And when you come to a clinic like Dr. Ofisi, these are the things that we try to help you get rid of, which you may, look at this one, poor sleep. Who knew that one of the leading causes of high blood pressure is poor sleep? You can imagine. So just a step further, not that, from the systems. So I said the kidney, which is the renal system, look at it, regulates blood volume, sodium balance, and releases renin, that renin thing that I talked about. So that's the kidney. The endocrine controls aldosterone, cortisol. Look at this one, thyroid. A lot underneath your chin, in your neck, there's like a butterfly shaped thing on your neck, like for the people that have Adam's apple, somewhere around that area. Right beneath, there's something called the thyroid gland. Now, we know thyroid because some people have goiter, this one that shoots out on the neck. But did you know that hyperthyroidism, oversecretion of thyroid, and hypothyroidism, both can actually affect blood pressure, both hyperthyroidism and hypothyroidism. So you can see the hormonal system actually affects so this is what it does. It causes retention of fluids and also vasoconstriction. Okay? I know that the nervous system, I talk about the autonomic nervous, the sympathetic and parasympathetic nervous system. So chronic stress, modifiable risk factor, okay, can actually raising your BP. Let's go. I talked about the blood vessel. When I say vascular endothelium, I bracket the blood vessel. It says your blood vessel, this your blood vessel, produces a nitric oxide. For what? Vessel relaxation. So for people who want to make babies or make love to their wives or whatever, this is the main ingredient that your blood vessel have to produce for that sustained erection stuff. So why am I saying this? This is where the concept of Viagra came from. So the Viagra drug actually works in around this pathway, the nitric oxide pathway, in relaxing the blood vessel and increasing blood flow like that, like that. So you can see that even your blood vessel produces nitric oxide. And then see here, it says oxidative stress, okay, reduces nitric oxide and stiffens the artery. So if you have a stiff artery and reduced nitric oxide produced by your blood vessel, you will have BP. Meanwhile, you're going to cardiologist, and the cardiologist is telling you that what I'm seeing around the chest and heart area is fine, and maybe there's just one part of your body that you have. I mean, the arteries are actually, they can actually check the arteries around the heart. The cardiologist usually picks that up also, but that the body is complex. So why I keep saying that is that please forgive yourself. We will do our part. Cardiac function. Okay, so maintains cardiac output and vascular resistance, increases output, taking elevated. Anyway, remember, this is not a technical class, so I'm sure you got the idea. But the most important idea is that what I just broke down is that when somebody has a high blood pressure, it can come from the cardiovascular system, it can come from the renal kidney system, it can come from hormonal system, it can come from nervous system, it can come from the blood vessel. Look at it. This is the blood vessel. This is a healthy blood vessel, and this is a hypertension blood vessel. And there's a decreased production of NO, nitric oxide, and that's where you get the blood pressure. So it's good for us to know this. Now, this is my best part, because this is the part that I am, if a cardiologist has discussed this with you, in fact, if I'm telling the truth, I think we can make a bet, okay? And so, I told you I read the New England Journal of Medicine. I read a lot of because when you do the Harvard program, I did my lifestyle medicine with Harvard Medical School, you become like alumni. So there's this group. So all the studies and new things that come, you can get it from that platform. So one of the shocking one that anybody that missed this lecture, you have missed it, is, well, let's just say that modern research reveals that poor gut health actually contributes to high blood pressure. What is gut? Your stomach. If you have, hear me, if you have constipation, diarrhea, irritable bowel syndrome, bloating. You don't go to toilet every day, you go once a week, like a cousin of mine that used to go once a week, but to God be the glory, she now goes maybe 2 times a day now, okay, etc. If you have a poor gut health, gut is, when we say gut, we've done a lecture on gut, is between your mouth and your anus. So if you're not moving your bowels properly and you don't have a sound gut health, only that one alone can contribute to high blood pressure. So now remember, we just talked about the cardiovascular system, the endocrine, the renal, the this, and now the gut. Oh my God. So now I'm wondering, why is it that when people come to Dr. Physic, and their blood pressure is moderately elevated, and we do colonic hydrotherapy, after a week or so, they say, my blood pressure is now normal, my this is now normal. I'm like, what's good? So this explains it. So let's look at it together. So it says modern research reveals like gut microbiome, that is, the gut has a lot of bacteria. And when that bacteria is out of whack, it affects the gut health, causing any of those gassing, bloating, belching too much, ulcer, stomach pain, grumbling, pile or hemorrhoids, all of that is still poor gut health. Now, look at it. It says this is the breakdown. Gut microbiome, okay, that is there. You know, I always say you should take probiotics. So if you don't have enough probiotics, okay, so less vessel relaxation, more inflammation. So when you have inflammation, like a low-grade systemic inflammation, your blood pressure is going to be elevated. So the study, I just picked from parts of the study. Some people have leaky gut syndrome and they don't even know it. So they have like bad bacteria and reasons for them to have like their gut has like little holes that allow small things to leak into the bloodstream. So this is caused by damaged intestinal barrier, which allows toxins from the gut to enter the blood. So that toxin from the blood is not killing you because it's at such microscopic, tiny little nano levels. But guess what? It is affecting the blood pressure and it's affecting the health. So it triggers systemic inflammation and what? Arterial stiffness. Another one, chronic inflammation. A lot of people have, that's why when you come to do colonic hydrotherapy, we always give you things like dewormer, acid reducers, this, that, etc. Some people have a lot of infestation inside their gut. So chronic gut inflammation is not chronic gut infection, but that inflammation will constantly mess up with your immune system. Remember, we learned that 70% of your immune health is controlled by your gut. So if your gut is in charge of 70% of your immune health, then when your gut is unhealthy, it's really dangerous in general, not to talk of the fact that we now know that it will affect your BP. Now, there's something called your stomach is connected to your brain. It's a complex thing to explain, but maybe another day, maybe if we just do gut and gut health, I will explain again the gut-brain axis. So it says poor vagal tone increases sympathetic hyperactivity, sustained vasoconstriction, and high blood pressure. So whenever that disruption exists, there's vasoconstriction. When there's vasoconstriction, there's high blood pressure. What is the summary of what you need to take from this slide? Is that if you don't have the best of gut health, it can. It's not everybody. So what's my point? My point is that when you're looking for why am I having this blood pressure issue? Is it that you've been drinking alcohol, smoking, or not sleeping, or you didn't eat well, or have reasons that you don't have a gut, that is a stomach contribution to a healthy blood pressure? You should ask yourself that question. Two, could it come from stress? Could it come from kidney? Could it come from hormonal imbalance? So take home now is that just know that this high blood pressure can hit you from anywhere. So the question becomes eventually, what do we do? So that is where we are heading to now. So we have gut supportive strategies. Let's start with that one before we go back to the other side. Naturally, if you can increase fiber intake, there's this product that I developed for myself. I don't sell it, God forgive me. I just carry fiber and I mix with vitamins and I just mix it and I make sure that is how I start my morning. So that whether I get to eat or not, I know that I have done my fiber requirement, I've done my vitamin requirement, I've done my protein requirement. I use Aminovite and mix it with fiber and I drink it in the morning because this health is very deliberate. Another thing that will give you fiber is plantain. Plantain has a lot of fiber. Even ripe plantain has a lot of fiber. I did promise that we will do a lecture on fiber because if we have enough fiber, honestly, almost half of our problems is gone. Because this fiber, okay, think about it. We eat a lot of bread. Eating bread will give you what they call a lazy bowel syndrome. There's no fiber in bread, hardly. Okay, you can see one or two, none. So we grew up eating bread, biscuits, groundnut, no fiber. Then how are we going to have a healthy gut? Okay, so let's do that. Use probiotics and fermented food. We talked about this, I think, last week. Okay, fermented food like yogurt, they also have zobo with live culture, etc. Um, Reduce sugar destroys your gut bacteria. It just destroys it. I'm talking artificial sugar, like if you add white cubes. A lot of people on this platform don't eat sugar, so no need to waste time there. Okay, so this would decrease. So when your gut is inflamed based on alcohol intake, even something as simple as wine, because in Nigeria there's a lot of adulterated wine. You people may be drinking for your heart, but you don't know. There's a lot of videos showing where they're making wine under the bridge, etc. Sorry, just the truth is, if you're drinking the wine and or whiskey and you're getting healthy and nothing is wrong, please, by all means, because what I teach is lifestyle modification, not life elimination. If something gives you joy and you still don't, you feel good, you go to your doctor, everything is perfect. Honestly, I'm not the one to quickly remove it from you. But it's when you're not feeling good and you're getting sick and something gives you joy, you're still taking it. That is when we are going to enter the same leg of trouser. All right. So manage your stress. Stress kills your gut bacteria also, and then also limit all this ibuprofen. Ibuprofen. I saw one commercial. If you're a mechanic and you have headache, take this. If you have leg pain, take this. I felt so bad for people that will be taking that drug as a supplement because it says everybody should have it in their pocket. It's so sad, but let me tell you, it disrupts the lining integrity of your gut, and that barrier is broken. It can cause ulcer, etc., etc. So let's summarize. And remember, I told you today is to just talk about mostly what is this hypertension all about. And Wednesday next week is I don't want to label it hypertension cure because it's not good to say hypertension cure because you know what? You will quote me, oh, Dr. Susan, I tried this and it did not cure my hypertension. As you can see, hypertension is very complex. But however, we have recorded success in fact, today AIT reached out to me that please can they have one or two of our clients or patients who has gotten rid of their insulin or got off diabetes medicine or got off, oh my God, I just tried to reach out to people. I had well, it may not sound like a lot to you, but at least if you have like 3 people on the diabetes side and 7 people on the hypertension side saying, I want to talk on AIT, that when you do certain things, you can get rid of your hypertension and diabetes. That gave me so much joy. And that happened today when the AIT actually contacted me to give some, when they're doing their programs, they will interview some people in the background, so they called us to volunteer some people. And I was so happy that they will even reach out to us for such, for such needs. So the reason why I'm dividing into two is because it's lengthy, and I don't. After 45 minutes to 45 minutes or so, the brain is a little bit tired because it's a very technical topic. So let me just wrap it up this way. I'll still give you something that you can start doing today to help out the BP. However, next Wednesday will be strictly how to get rid of. So today is overall overview, and I hope it helps. And I really hope you actually appreciate it, because it will remove a lot of questions from your mind. God forbid, especially for those people that will think, oh, could it come from my village? Which I know that we don't have those people on this platform. So when we don't get rid of hypertension in the long run, this is what breaks my heart. In the long run, people will end up with heart failure, stroke, kidney failure. Every time I need money for dialysis, kidney transplant, people have to queue. Now you can't even buy, in the past, you can actually pay the hospital, I heard, and they can find somebody to donate a kidney, but I think they took it the wrong way, they did it wrongly, and now you can have all the money in the world. They'll tell you to go and bring your brother or somebody. So now, sourcing for a kidney in Nigeria is nearly, in fact, it's illegal. So preserve the one that you have, please. Okay. It can cause lost vision from retinal detachment, which is mostly in diabetes, but you can have BP of the eye. And before you know it, your vision will just be coming down. Dementia, you will not remember. Okay? Peripheral artery diseases, etc. So these are the complications. So when you're playing around with high blood pressure, it's not that high, I don't want to start medication and this, you, in the long run, you're going to end up here. You remember this group, our platform is about longevity, and our definition for longevity is what? Is that we want to live as long as God has predestined. We can't negotiate our exit date. I believe that God knows when we are going out. But our longevity style is that we want to be dancing and walking off of this earth. We don't want to be wheelchair bound. We don't want to be a burden to our family members. We want to enjoy our lives to the fullest and then actualize our highest potential and be all that we can be and do whatever God put us on this earth to do before we go, without being a burden and being sick. So that's the objective. Imagine that you're blind. That's the end now, only because of high blood pressure. I say, God forbid. All right. So possible symptoms of hypertensive urgency and emergency, or let's say hypertensive emergency. If your BP is high and you're dizzy, run to the hospital. If your BP is high and you have a severe headache, like usually one-sided, run. If your BP is high and vision problem is persisting, see your doctor. If your BP is high and you have nausea and vomiting, a lot of people that had a stroke, it was accompanied with nausea and vomiting. If your BP is high, along with trouble breathing, if you even have chest pain, sometimes even the ulcer chest pain presents as, let me just make it very harsh on you, a stroke chest pain. The bottom line is you cannot leave a doctor out of the equation. You cannot leave the doctor out of the equation because they study these things so well. Now, don't get me wrong. You can get rid of your high blood pressure naturally. You can be lucky. You can do that. And I will teach. But you know what? Even if the natural approach did not 100% get rid of your high blood pressure, at least it will help you to keep the tablets that you will be taking, number one, at the lowest dose. Number two, it will work longer, because when I say natural medicine, I'm talking more on the lifestyle modification and the things that are clinically proven naturally to help bring down BP. One of them, because I said I will share at least one or two, is hang on, let me see whether I have it separate. Okay. Okay, I'll share it on my next slide. So this is the last slide anyway. So let me just finish it and then I'll share some little solutions, and then we will now meet on Wednesday for how to get rid of BP. We'll try. I mean, we can only try. If it doesn't go, at least we tried our best. Okay? So hypertension is best controlled through lifestyle choices, apart from the drugs. As I said in the beginning, when you're trying to get rid of your blood pressure, please take it from me. If you're ready on a blood pressure medicine, don't drop it yet. Do the lifestyle modification and be monitoring. The blood pressure will be coming down. So, for example, see that blood pressure has come to 115/70. You go and take 2 tablets, one in the morning, one at night. No, you will cut down to 1 a day. And then if you notice that even with 1 a day, it's still 110/70, then the doctor will help you to remove it. So that is how it works. So we taper off blood pressure medication until we get rid of it. We don't just throw it, because the pharmaceutical industry has designed that drug that if you drop it, by the time the BP will fly up, nobody will tell you to go and put it back. But you can actually slowly, gradually remove it and get rid of it. So hypertension can be controlled with healthy diet. Okay, so for example, I found out that there's a nephrologist who won an award in the UK for something around the kidney, and found out that Black people are more sensitive to salt than the white people. And salt, which is regulated by your kidney, I guess that is why it was a nephrologist study, is the highest lifestyle contributor, one of the highest lifestyle contributor of high blood pressure. Number 2, in Nigeria and in Africa, we the Blacks, if you go to America or UK, if they're eating what they call steak, we will call it beef, they carry it and just show fire. Sometimes they say, give me medium rare, bloody, no Maggi, no salt. That is how they put their knife, blood is dripping, they're licking it like that. How are they going to have blood pressure? We in Nigeria, if you eat beef, if it is not called suya, with a lot of seasoning, like Maggi, for example, seasoning. I'm not singling out the brand Maggi, but in Nigeria, it's like Omo. Every detergent is Omo. This one is like this. So when I say Maggi, you understand what I am saying. No, this, that, all those seasoning cubes. Because some people may not understand when I say seasoning cubes. Is the highest contributor to high blood pressure. So it says eat more fruits and vegetables. For me, I think if you eat more fruits and vegetables, you will not have time to be adding salt inside it, except you cook your vegetable with a lot of Maggi. But we're talking about fresh fruits and vegetables will decrease your sodium intake for the day. Use natural seasoning. Like me, I have developed a certain natural seasoning that when I put it in my food, it's sweeter than Maggi that I used to eat in the past. Hopefully in the future, very near future, we'll be able to share it in our clinic so that people can get it. You just develop something, but you will train your palate not to be too attached to Maggi. Follow the DASH diet and drink enough water. Water will help push out salt from your body. So this is DASH diet. Like I said today, we are not going to overly talk solution, but at least this should help. Asejara, there are 3 supplements that successfully, I've been using to manage high blood pressure since you have stayed this long. And sometimes, even without adding anything else, it actually helps me to reduce people's blood pressure. I know that most of you may say, oh, I'm already on it, but by next week, we will talk about holistic management of high blood pressure naturally. For me, it is omega-3, garlic, CoQ10. Omega-3, garlic, and CoQ10. The mechanism of action for those things I mentioned, like the garlic is going to act a little bit more like the baby aspirin, which is more of an anti-inflammatory and a blood thinner, So because if the blood is a little bit thin, okay, so it will allow the blood to flow better, okay. Of course, the CoQ10, its function with the mitochondria because the heart, of course, the heart is a muscle and it's, cells. Remember our basic biology, cells lead to tissue, tissue to what? Organ to. So it means that in your heart, you have cells. Your cells is called the cardiac cells, make up. And inside the cardiac cells, are mitochondria. And each cell does not have one mitochondria. Each cardiac cell can have 10, 20, 40 mitochondria. And all of them need something to make them tick, that metabolic function to function properly. So first, we can worry about keeping the heart generally healthy. And that is why inside the clinic, Oxivite goes a very long way because we are talking about high blood pressure. What is the problem with blood? Why are we even disturbed? Is that the body wants to pump adequate amount of blood for your unique body so that you have adequate amount of oxygen and everything the blood carries to every cell, tissue, organ, brain, every part of your body when it is supposed to carry it to that part of the body. I don't know if I made sense there, but the point is why we are even concerned about blood pressure in the first place, again, is that your heart has some kind of a gauge that ensures that a certain amount of blood volume with amount of oxygen and everything else gets to where the body needs. So it's the pumping machine of the body is actually the heart. So sometimes heart hypertension can come from your pumping machine can be faulty. Okay, so because I told you I don't want to really get into the part that your cardiologist can take time to explain to you. I just want to explain it in general. So it's a very deep and big study, and that's why you go to medical school and then you all take another 4 to 6 years to study your heart and be a cardiologist. It takes forever to be a cardiologist. So it's not a day's lecture, but I'm so sure that even with this limited and overview, you have a better appreciation of why it is very, very frustrating to start with, to just say, I want to cure my BP. Are you kidding me? Will you pay for the investigations to check kidney, hormone, this, that, etc.? It's a tough one. But next Wednesday, we will talk about holistic management. How do we treat with 1, 2, or 3 or 4 things that we can do better, not even allow the blood pressure to come, and then also help to get rid of the blood pressure. So since the time is up, I want to summarize and send you home with our Dr. Physique anthem, Abi, because this one is like an everyday sing song. I know that the regular people, once you see this slide, some people, they start even disappearing. Please don't disappear, please. You can see why our formula works. Even in everything that I have spoken about, you can see number 1, rest as medicine. On the bottom, it says rest or be rested. Rest is a requirement for excellent blood pressure. If you don't rest, you can't have perfect blood pressure. You have to. When I say you can't, remember I also said life is 80-20. There's that 20% exception to the rule. But you know what? That's not everybody. So just rest so that you can live longer. For me, okay. E for energy. Pay attention to your energy, environmental energy, cellular energy. If you wake up, just listen to your body. When you wake up tomorrow morning, let's do something together. Just listen. If you wake up feeling so great, refreshed, nice, the things you did the day before was okay. But if you wake up feeling tired, groggy, headache, not getting yourself, there's a high chance that maybe you drank alcohol, you did not sleep well, you did not eat well, you did not exercise. Something happened the day before, like within 24 to 48 hours is the reason why you wake up like that for the most part. So pay attention to energy. Oxygen. Do your deep breathing exercises. One of the things you will learn how to instantly reduce your blood pressure next week is going to be on oxygen therapy. So, like I said, in our clinic, we do Oxyvite for that, but there are things that you can do. I will try to see if I can get a hold of Bazant to remind me of the alternate nose breathing that people have used on this platform to get rid of their blood pressure and reduce their medication. We will talk about water as medicine. Water as medicine, we are begging everybody, make water your companion. You can see that dehydration increases sodium in the body and also causes high blood pressure. Dehydration disrupts the gut-brain axis. Your brain cannot communicate with your gut and it can cause a blood pressure. Dehydration kills the cells outrightly, especially the cardiac cells. Okay, so drink your water adequately. Nutrition. Pay attention to your micros and your macros. A day should not pass that you don't eat raw fruit. It could be garden egg. It could be cucumber. For us in Dr. Physique, we said you can add others, but those are the two that we love the most. So you can still do your apple, you can do this, but we prefer the green things. Okay? All right. Of course, except if you have a medical reason not to do the green things. Exercise as medicine. You will learn the role of exercise. You know those people that have stiff arteries, that no matter which drug and medication you take, your blood pressure will not go away. You could have a stiff artery. So we have a ways to use omega-3, a little bit of exercise, hot water therapy, things like that to try to soften the arteries. There are ways, okay? And then there's some well-studied herbs that have been shown in clinical practice to actually reduce the blood pressure. We'll go through that. Detoxification. Under detoxification, one that we know guarantees, at least helps the blood pressure is colonic hydrotherapy. So I want to say, in conclusion, don't run off, is that even in healthy and active people, high blood pressure still can rise from hidden dysfunction in internal systems. We've talked about it could be a faulty kidney at a very low level. That tiny, if you do your test, they say GFR, normal 90, my own 70. That alone, it could just be the reason for that BP going away. So we have to work, maybe give you kidney tests, bring it up, etc. It could be overactive nervous system. If you're always angry, shouting, even nervous, that can keep it. Damage to the blood vessels. If you're always taking, painkillers, especially NSAIDs, like aspirin, ibuprofen, and all those things, they will damage you. Gut, we talked about it. So a fit body, okay, a fit body does not always mean a balanced internal physiology. I think that even if you did not learn or take anything away from this lecture, I'm just happy that that you know that high blood pressure can come from many places apart from your chest area, which most people believed. So true wellness require caring for internal system, especially the gut, the hormones, the nervous system, and not just muscles and diet. So when you go to the gym and say that you're a sports master, is not enough to guarantee health. Health is what? Holistic. So thank you so much for your time. Now I'm sure you will have better conversations with your cardiologists and your doctors, and you'll be more forgiving. And now, if you want to run away, you can run away. And thank you so much. But please don't miss next week. So we'll do a quick summary of today's lecture, and then we just go straight for solutions. And that's it. We should be monitoring our blood pressure at home. And please, I will take your questions. Thank you so much for being so patient. Okie dokie. Let me stop sharing my screen. I'm back. This is me.
Good doctor.
Okay. So for those of you that are joining for the first time, because I found that people are joining from US, I've seen some numbers from the US here. People are joining from Canada. And if you're seeing 85 on the Zoom, there are so many more people that are on the YouTube platform that is not reflected here. So sometimes I heard we are like 300 or more people on here. So depending on what platform you're joining from, I want to thank you for your time. Today may not have been the biggest lecture for you, but maybe another. Just keep coming. Don't miss Wellness Wednesday. 45 minutes of your time once a week will make a huge difference where you end up when you're older. So thank you so much. Let me see if I have any questions. All right.
Thank you, doctor.
I'm seeing, yes, hi.
Yeah, thank you. Well, good doctor.
My co-presenter.
I want to find out the what do they call it? The lower one.
So I cannot hear you.
I said the what they call the one the dialytic you know the stylistic for BP
Yes.
measurement. Why is it that lower one is always difficult to come down?
Okay, you mean the diastolic.
Sorry, what they call it. That it
Okay.
comes if you measure the first time,
Yes, sir.
if the two of them are too high, if you measure second time, the first one, the upper one will just come down. But this one can just minus one. So close to come down.
Okay. The truth of the matter is that
And I was
it's
told
not.
that is that one is another one. I don't know how to this. That one controlled by feeding or feeding system what to eat.
I don't know why, but it's tougher to hear you today, unlike any other day.
Maybe system. Are you hearing me
Are
now?
you on speaker? Are you on earpiece?
No. I'm seeing you very well. Are you hearing me now?
Yes, I can hear you.
No, I said that when you measure the something, the first measurement, you
Yes.
have the two of them high. Then you measure second measurement, the upper one comes down faster. The other one will
Okay.
just do little. Then you measure again, the upper one will still come down. The lower
Yeah.
one will just do very little. So why is it so?
Okay, you mean the diastolic
Yes,
pressure,
so,
right? Okay, so we said that too, there's systolic and there's diastolic. Well, what I was trying to explain, even from before you re-explain, I thought I heard you very well, is that it's unique to you and not to every single person. Number one is that, okay, let's just oversimplify it. The diastolic is a higher number, and the systolic is a smaller number, and goes into how they determined that. So you can easily see the systolic pressure, the systolic come down. So the things that affect the systolic, it's a lot less technical than the diastolic. And that's why they say that the diastolic pressure is a little bit more dangerous than the systolic pressure. So I think what I want you to take away from this lecture or from your question is that number one, don't be too fixated on either systolic or diastolic. Be fixated on both, right? If you see that the systolic is coming down and the diastolic is stuck, it may just mean that you need, I'm talking medically now, you may need just a different class of the drug, because as you can see, all the sorry, are you noticing this decrease in lack of decrease in diastolic based on artificial blood pressure, or based on natural natural treatment?
No, what I'm trying to say that yeah, these things happens. I'm talking about when I don't. Are you getting me?
Your phone is stuck.
I say that if I measure, if I take my BP drug and measure, I don't have problem. All of them come down. But when
Okay.
I don't take. Maybe I don't want to take BP drug, and I measure it 2 times. The other first one will come down, but the second one, that lower one, doesn't come down like that.
Okay. Well, I think it's a little bit individual based. I don't know why it wouldn't come down together. I only know that blood
It comes
pressure.
down. It comes down. It comes down, but the other one comes fast. It comes. What I mean by the margin of the other one is the upper one is always higher. The margin of coming down. The other one comes down slowly.
Okay. Anyway, they take
Now,
home what I want.
What I do that before I do my BP, because if I take BP drop there, I do exercise and everything. The following morning, if the following day, I need to measure it, because sometimes if I measure it, it will come low. So if you do, I not drink. Because if I take like yesterday, today, I do exercise finish, I need to measure again, because sometimes when I measure like that, I'm getting 11577.
Okay.
So I'm not take the drug for that day.
Okay. Okay. The issue of blood pressure is very, very individualistic. As you said, you've noticed that the systolic comes down easily all the time, but sometimes the diastolic does not move as fast as systolic. I think that is the observation, isn't it?
Yes.
So what I am trying to say is this. If you're on a medication,
Yes.
it may just be because of that medication. Some medication are more systolic friendly than diastolic friendly. Originally, the medications that the doctor gives you aims to bring down both at the same time so that you achieve your 120/80. But sometimes, depending on the underlying reason, your own unique reason for the BP, because when the doctor starts giving you a BP medicine, they are not 100% sure yet. Sorry, is this hormonal? Is this kidney? Not all the time. Is this heart? Is this gut health problem? Is this a nervous system problem? No, they just give you. Most patients just go and stay on that drug for life. Most patients, they just notice that it works once and for all. And then maybe if it works, and then the doctor sees that it's almost okay, the doctor decides to leave you on it. Now, it is more technical, like it's harder for the systolic to come down because there's, unlike the diastolic, it's usually an underlying reason. It's why the systolic blood pressure comes up and stays up. So what I would advise is that, okay, you know what? If you truly have a concern where your diastolic is not where you want to be, first, we can change the class of drug, okay? Two, we can try other natural things, etc., to try to bring it down. But there has to be an additional effort. But just know that all the drugs that they make don't equally bring down systolic as diastolic. So some people go, they have a diastolic BP. So the drug they will give you for diastolic BP is different from if you have both systolic and diastolic that is high. There are some people that they have a normal diastolic, which is the bottom, and a high systolic. The blood pressure for that person, blood pressure medication for that person is different also. So there's a way they are managing all of it. So that's the bottom line.
What I wanted to say something. One thing that if I take the drug, two of them come down.
Okay.
Sometimes I'm going to do it maybe by breathing exercise. You understand me?
Yes.
I will not take drug.
Okay.
The other one, the other phase 2 one, the higher one coming down faster
Okay.
than the other one. If I take drug, all of them come down together.
Okay. Okay. I totally understand.
That's why, like I told Nana, that if I take drug today, the following morning, before I take any drug, I do exercise, take kilometer walk, do everything I want to do, and I come back. I need to check because I found that if I check, I find out that it will be as low as 75, 77, 115. So that because of what I've seen, I'm not taking drug that day.
Yes.
Because
okay.
And tomorrow morning I do it again. I still find this it's just normal. I'll not take drug. Then or maybe on the third day, if I check it maybe a little high, then maybe 120, 130, 988 or something like that. Then I myself to take the drug.
Okay. So, okay, I totally understand. So it means you may not even have a true BP because you're generally a very healthy person. There's a reason for your BP because you said something that when you do the breathing exercises only, some days is enough to give you a very low number and you don't have to take your medication. However, you always notice that easily the systolic will come down and not the diastolic. So it means that the blood pressure medicine you're taking, it's a more diastolic friendly. It's a very unique question. Don't worry. Maybe you call me and we can more iron it out so that I can take one.
One thing I want to do, I want to ask maybe for general knowledge too.
Okay, sir.
I found out that people who are maybe on BP drug, and then they don't check their sugar level, they don't check their cholesterol, they just look at BP, and then when something happens, they say, did you take the BP drug?
Mm-hmm.
But most of the time, I find that most of them don't go to check their cholesterol, how low and high. Then sugar level, they don't check it. So when something happens, it was killed by BP.
Yes. Sir, thank you so much for highlighting that because that is part of my lecture next week. Other reasons for, because I said there are so many reasons. High cholesterol alone contributes to high BP. High sugar alone is a leading cause of high blood pressure. So there are many, many things. So it's a good thing that you mentioned that, so that way, I know you sound like it's because you're a community person, and you're always talking health wherever you go. So you get to hear what your colleagues are doing. So I want to ask everybody on this platform that health is holistic. It's holistic. If you don't take, if you, even if you see that your blood pressure is normal, just an increase in your cholesterol, sugar, maybe poor kidney, whatever, can just throw you off and you did not expect. So I want to thank you, sir, for adding to that, because yes, high cholesterol alone. And that sometimes people come to our clinic, we just get rid of their cholesterol and the BP regulates, because remember that artery, I talked about narrowing of the artery. If you have cholesterol plaques that are choking up your arteries, how will the blood flow? It will be the same as narrowing of the arteries or even vasoconstriction. It has the same effect. Thank you so much for your contribution. Somebody asked a question, can you help us with the recipe for natural seasoning, please? Okay, sure, why not? Natural seasoning, no wahala, I will. Well, I don't know if I want to do that here, but okay, I'll try my best. Okay, so natural seasoning. Okay, so the second question is that great presentation as usual. No, meeting was insightful, etc. Okay, it's okay. I didn't. So thank you so much for your questions. I didn't even expect many questions today because this is the technical wing of the presentation. So let's just address the natural seasoning, and next week we'll come and talk solution of how to get rid of VP. Well, the natural seasoning is at a very experimental level for me. And you can do, there's something called bonga fish pork. You make it as a powder. I heard it's extremely sweet. So, and then you add, it's mostly fish, bonga fish, and there's a crayfish, and there's the big one, the prawns one. That one too is extremely sweet. So if you mix the bonga fish and that extremely sweet one, it makes your soup sweet like Maggi cube, and then you put like fermented locust beans, the dried one. If you dry it, you add it. So for me, and then sometimes I add like coconut extract inside. So that's just what I have on my kitchen counter. So it's not perfected, but at least it's helping me to not eat any Maggi cube. And then sometimes I like if I'm making like breakfast type of vegetable type of things, I'm the kind of person that will drop if I have extremely sweet orange juice, I can make orange juice with I know that I have Oyibo palate a little bit, so it's not applicable. So the point is that I found ways. So maybe let me take it as a homework, how to live without Maggi and how to sweeten your food without artificial seasoning. But what I have in my kitchen is bonga fish and that big prawns. I powderized it and it makes all my Nigerian food taste very, very sweet. And I add locust beans. So that's just what I'm using for now. So that's the recipe. Okay, so by God's grace, we'll see you next Wednesday. I really hope the lecture helped. And God bless all of you. Have a beautiful evening. I always pray for you that just for spending this time with me, God will perfect your health. And even if you know a little, God will